Hi, and welcome to Matt Holman Talks Mental Health, the podcast where I have the opportunity to catch up and chat with amazing humans. For this episode, I'm so happy to welcome my friend Odete to this conversation. Welcome, Odete.
Thank you, Matt, for having me.
You're more than welcome. I'll let you do your official introduction in a moment, but I just wanted to say thank you for participating in this podathon, these 24 hours of 24 podcasts. And this is episode number 8, which I understand is your lucky number. So that's
It is.
perfect.
Yeah.
And that wasn't by design for anybody that's listening anyway. So Odete and I met a few years, oh gosh, I can't even think now, a couple of 2-3 years ago, I guess, at an event.
3-4 years, yes.
Yeah, she was hosting in the Netherlands. So Odete's based out in the Netherlands, and it's interesting if I say the first time we met was in a boxing ring, but we weren't fighting. It was a theme for a conference that you were hosting, and I had the pleasure of attending that and participating as one of the keynotes to that session as well. So it's been fabulous. So we've stayed in touch, and Odete's passionate around the whole thing of mental health, supporting others, and you're going to hear that. So I'll let you do your introduction properly, Odete. Pleasure to see you. So happy to have you.
Okay, my name is Odete. I live in the Netherlands and I work in the Netherlands, and I work in the business travel industry. I run the Dutch Association for Travel Management. I'm an entrepreneur, and my background is HR and travel, but most of all, I'm a wife of my husband and a mother of my daughter, 16-year-old. This is what I live for, and my family, of course, because that's the most important thing in life. HR comes back in many ways, but you will hear that when I tell my story.
Yeah, brilliant. And welcome. And you know, I know family's a big thing. We'll probably talk a little bit about some of that too. And like all these conversations, it goes where it goes. And I know you haven't shared with me too much in advance, so we'll go where you will want to take it. It's your story. Please tell us about your journey with mental health and how you
when you asked me to join, I said immediately yes, and then I thought, oh, but do I have a mental health story? And when you go along your path of your life, then you think, oh yes, I did have them. Yeah. First of all, I come from a family with a Portuguese father, a Dutch mom, and I have a sister. And that marriage didn't make it, so my parents got divorced. So that's the first part of your mental health. And for in my family, it really caused some hurdles. And eventually, the contact between my father and my sister was disconnected for many, many years. And I didn't see my father until he died a few years ago. But for me, it made me stronger in life. It really showed my path, how I really want to survive and live my life. To be independent for all, that's one of the most important lessons in my life. And that really helped me think of every step that I took in my life. I had many jobs before I ended up as an entrepreneur 7 years ago. But every time I learned something else. The majority of my career, I worked for publishing houses. Okay. But in the 90s, beginning of the 90s, there starts my mental health first, because one day in September, I woke up and I couldn't get off of my bed. I couldn't move anymore because of a hernia. And that made that I had to recover, be treated. And I was 29 at that time. And I thought, oh my God, I'm not going to spend my life in a wheelchair or whatever. I really need to be able to walk again. Yeah. So there was my fighting mentality that helped me through it. And of course, the chiropractor that really helped me 3 times a week to recover. And after 6 weeks, he said, well, take a walk for 100 meters. And I couldn't make it until 50 meters. So that was really an eye-opener. And that was caused by the way how my desk at the office was installed. So I could easily take everything from my chair, which made that my back got hurt in a way. So that was an eye-opener. And I wasn't a manager in that time. So I always looked after my staff if they really were physically well, mentally well, and there it began. And at the end of 1996, I really had a burnout, and that happened really ridiculous. I was one of the representatives in the Works Council, So we had discussions with with management, and they were gonna, yeah. At that time, you could, yeah, you can hardly imagine now, but at that time you were allowed to smoke in the office, and there was going to be, yeah, it was going to be forbidden to smoke in the office, and that really freaked me out because I had part-timers, all ladies, and they catched up at the coffee machine smoking their cigarettes, and then they would go back to work. And that was a really, that, yeah, a lot of things had happened being in the works council, working at middle management level. um, what was I, beginning 30s, yeah, 33. And I was always facing my career. It was important to make career, to work a lot, and this was the most important thing in my life. But all of a sudden, none of this was there anymore. So I fell down. Well, I didn't fell down literally, but I had to step down from my work, and I realized that I couldn't be in the neighborhood of the office. So for 2 3 months, my husband took me, yeah, in the neighborhood of my office, and I said, I can't face it. It was really terrified to go in there. I didn't know how to recover, and that also made me realize that work is just work.
Yep.
It doesn't matter how, yeah, it's not that important anymore. So at that moment, I had a great career. I had a, yeah, very nice life. And my husband said, it was my first husband, I have to say. He said, yeah, but this isn't everything. Your health is more important. So why don't you find another job and look what you really love, and what's your passion? So I went for a search to different. I went to different employers, different types of roles and at a lower level. It cost me 100, €1,500 per month.
Right.
Yeah, less income, but I was much more happy. So but yeah, what is the story of my life is that wherever I come, I get a manager role, or yeah. So at one of those roles, one of my bosses said, what do you want to become when you grow older? And I said, well, really, when in the recruitment process that I was hired at this company, HR really was disrespectful. They didn't treat me as a human being, and I think that can be done better.
Yeah.
So in that way, so he said, okay, so what do you want to be then? I said, well, I want to be in HR. So he supported me for 2 years to do the education for
Yep.
HR. And after 4 years, I left the company and went to, I worked for Sanoma headquarters, and I was the HR business partner in combination with travel. So that's how I get to the role I'm in now. But the reason that I came there is that I really have to focus on human beings. And I have a natural approach that I really want to get the best out of people. So if I have an interview with people, I always try to see if they are a match,
Yep.
but also if they really want that job because of the role, or the respect they get, or because it's their passion, because they're good at it. So yeah, there were many interviews that I said, hey, you're good, and these are your competencies, and this is what you're capable of, but you don't match in the team. And I think you should go for what drives you, because you have to wake up every day, and you have to go to the office and do your work. And this drives me still, even in the role I'm in now. Yeah, there's so many things are happening at the moment. I mean, mental health. I invited you to have a presentation on that, because I work from home. I do it already 7 years, and I'm used to it. But when COVID came, I didn't realize that this is not normal for many of the people working. So this was really an eye opener, I must say. And coaching is something I really love. And I do that for free. I did that for free many years, but I had a coach, and my coach said to me, "Oh, that it's time that you do it as a professional. So you really should start your a next assignment and do your coaching role official." So I started in January
Brilliant.
for coaches, and this really gives me new energy. And I think, we talked about it many times. I really want to go on a course with you on do the mental health practitioner course, because I really want to have some theory behind it.
Yep.
Then, really try to focus and coach people to get the best out of their lives, because I think that's the most important thing.
It is, and it's bringing human back into this equation, isn't it? And
Yeah.
and you said it, and what I love, Odete, is your story around your evolution over the years. You know, the changes, but realizing that it's about humans, isn't it? And you know, and working with you with the ATM, and it's about the human movement, and that's what we've got to remind ourselves is business is important, but people are most important. You know.
And that's what you see when you have online now.
Yeah.
I had 41 online sessions last year,
Amazing. Yeah.
and I love talking to you, but I'd rather have a cup of coffee or tea or whatever with you when
Yeah.
we speak live. I mean, we
Yeah.
are humans, and
Yeah.
that's what you see. Um, okay, we like this, and I always debate the topic. The future of work is work from anywhere. Okay, that I understand, but work from home is not going to be it.
No,
I
it's
think
going to
I
be a
think
mix.
no, I think employers really underestimate the impact. If you
Mm.
have little children, if you have bigger children, I mean that doesn't
Yeah.
matter. Yeah, when you work from home, it's different
Yeah.
because you have so many more things to manage.
Yeah, absolutely. And at the moment, and we're seeing it here in the UK, and no doubt you're seeing it as well in the Netherlands. You know, it's life is blending in with work, and work is blending in with life and schooling. And gosh, there's so many different variables now that we weren't anticipating just over a year ago, were we? So we all thought it was going to be good and everything was going to go in the ascendance. We've had a pause. What have you done? So you've obviously kicked off this coaching thing, you know, the training that you started, which is fantastic, and I really think that's amazing. So what have you done personally over the last 12 months to maintain your well-being, because you were a traveler as well, right? So you
Well,
haven't been able to do so much.
yeah, that's correct. And I, on one hand, I miss it,
Yeah.
and on the other hand, I am really at ease. I have a beautiful garden.
Yeah.
we
Yeah.
have two dogs, so we have an evening clock now, so I'm allowed to go out after 9 because we have
Okay.
two dogs. I hardly walk the dogs, but now I really want to walk the dogs.
Yeah.
And the weather was nice. So
Mm.
I experienced it in a very strange way, because in February I was in the UK, and in March there was the lockdown.
Yeah.
And then I had to cancel my holiday, and I booked my holiday now, and I'm really keeping my fingers crossed. Then we go on vacation again.
Yeah.
But if not, it's not. I mean, then that comes another time. But I managed, because I had I had it busier than ever.
Mhm.
Yeah, because of all those online sessions.
Yeah.
Managing family life. I mean, the children, they could go to school, they couldn't. So now my daughter's in years of exams, so she can't go to school. Um, yeah, but that you have to really manage that for yourself. And I'm more at ease,
Good.
but
Good.
I'm longing for the live events and the traveling again, to be
Yeah.
honest.
It's a craving that we all have, I think, isn't it? We're all
Yeah.
craving that moment where it's allowed, and we know it's safe, and that's going to be the most important thing. And hopefully the anxiety is not too high for people.
Yeah, and to hug. Yeah, I'm really a hugger. So
Yeah.
to hug my friends and my family, my parents. I mean,
Yeah.
this is really, I'm really missing that.
Yeah, that is hard, and we all, and I'm a hugger too. I put out announcements when I'm going to conferences that I'm hugging everybody. That was before COVID, so it wasn't during,
Yeah,
it was before, but I remember doing that, and the reaction was quite interesting actually. Most people were receptive to the hugs, some people didn't want them, and I'm never going to force one. But I do want to go backwards a little bit, because you made a really interesting insight into when you experienced your own challenge with burnout, and I, recognizing sort of these moments in our lives where you have to stop and pause. Can you give some insights? Because obviously people listening, what were the signs that you got to burnout? What happened to you? I know you said about pinned to the bed and things like that, but anything else that you saw coming or you felt was sort of bubbling away?
Well, I start dreaming, having nightmares.
Okay.
And constantly being focused on work.
Right.
Really cannot switch off.
Mm.
So for me, that are signs that if I hear people saying that, I always say you should step back a bit.
Yep.
Because work isn't everything. I always say work isn't everything. Then they look at me and said, no, it's not.
Yeah. Do you think? I was going to ask a question, and it's a cultural question, really, because I was chatting earlier to somebody from India and had an amazing conversation about culture. How does the Dutch culture sort of adapt to some of these conversations? How would you evaluate, or how would you position that or say that, do you think?
If it's accepted, you mean?
Yeah.
It is sort of. I mean, people are not screaming and shouting, hey, I had a burnout.
Okay.
Because, and I think it's a strength. It's not a weakness.
Yeah.
But some people see it as a weakness. But I always say, don't condemn people if you haven't been there. So, I mean, you cannot really say what the effect is on people if you haven't been there yourself. And honestly, everything I lived through helped me in getting a better HR professional. Because I see the signs, I can warn people, I can really have a one-on-one talk. And for me, that's really helped me evolve.
Yeah.
And I'm so happy that I was not affected by depression or those signs. I mean, and I'm always positive. I try to see the bright side of life.
Oh, just knowing you for a few years, I can see that. I know that. Look, you smile as soon as I say it. So absolutely, you're not a pessimist. Definitely, you're an optimist, right? You're optimistic about the future and what's going to happen, and that's fantastic. I think, the idea of these conversations, of course, is to just sort of share some of those thoughts, those reasons why we are the way we are, or why we do the things we do. I think what's fascinating in your story is this sort of evolving role of the human resources part. And I've said that already, but I do think that's such an important part to think. There's a lot of companies or people who work for companies today who may be HR, people, or may be responsible for managing others. What would you say are the key elements to being a good, empathetic HR person?
Oh, I think you should, first of all, not ignore the signs you had yourself.
Yeah.
Always translate them into the people that come to you. And when they come to you, take the time, sit back and listen to their story. Don't tell your story, but listen to their story. And then ask them how you can help them.
Yeah.
If they need any help and how you can help them. And give them advice on where to go to, how to, and help them to not see it as a weakness.
Yeah.
Because it overcomes you. You don't plan this. This really gets to you. Your body is something that gives you signs, and you should listen to your body.
So true. And the physical mental connection is so clear, actually, when you think about it, because just having an injury or an illness makes you feel mentally unwell as well. It does all connect to itself, and it can induce anxiety. It can induce other issues and challenges, of course. So I think they're all wise words, Odete. I work with HR, and and I know you're very passionate about this subject as well, and coaching and supporting HR through, remember, it's humans in the first part of HR, I guess, right?
It should be. Unfortunately, I don't know nowadays, but unfortunately, 10 years ago, 8 years ago, it was about numbers.
Oh, yeah.
And I didn't fit in anymore. So the redundancy was fine for me. So I said, okay, that's fine. I always said if someone was laid off, hey, but other doors open up. Yep. You're not going to see it like this, but live through your pain. And then when it's time, you see that other doors open up.
Yeah.
And that happened to me as well.
Yeah.
Yeah.
And now look at where you are. You know, you're doing great.
Yeah.
You're smiling. You're still very positive about where the world's gonna, you know, where we're gonna go. So you're coaching. So the things that you're learning. How long's that course? How's it going to take you?
What I'm no, I'm not following a course now.
Oh, okay, sorry.
No, I want to follow a course. But yeah. And now I have 4 coaches from different generations. That's really interesting. From student to someone, almost at the end 50s, different industries. So that's very, very interesting.
Very interesting, yeah.
I love the students as well.
Okay, yeah. So student to master, is that like to the master?
Well, she graduated on tourism, and now what? It's Corona, and I said, you'll get back there. You'll get back there.
It's going to come, isn't it? It will come. We'll get the vaccines out. It will come.
Yeah.
It's incredible. So
I'm first in line.
Are you? Yeah.
Well, as soon as I'm allowed to have one, I'll go there. Yeah.
Yeah. Well, fingers crossed we have enough for everybody and we can get them back there and stuff. So, anything else, Odete? Anything else you want to share? We're almost at the end of this, and this is going around so quickly. Anything else you want to share with the people that will listen?
No. If people have problems, don't stick with it. Talk to people. I think this is very important. And don't think you're the only one. There are a lot of taboos in the world, and this is one of them. And I think it shouldn't, because this can make or break you. And life's too precious to be broken, to me.
Yeah.
Yeah. I think this is one of my end lines, I think.
Oh, I love it. I think it's very wise words. It is too precious to be broken. And we do need to, you know, to recognize that when things are not quite right, or when things feel uncomfortable, or we're not in a good place, is to have the ability then to reach out and to talk to people. And I think it's so important. You know, that's why this is going on right now. We need to talk about mental health. It's been a conversation that we've been having for over a year in this, you know, COVID world of virtual, but virtual's actually given us a great opportunity to do something as well.
Yeah.
And you know, have these sort of events and, you know, talk to many people. But, you know, the more people that talk about their experience, the more people that share their stories, which is why I'm so passionate about doing this, the more people can connect to us all. You know, we're all accessible human beings, aren't we?
Yeah. And I'm so happy that the lineup you have now, but you had before already, there are some people that I really thought, okay, I have to listen to yours, because I didn't expect you to be one of the ones having a mental health story. And perhaps people won't have that when they know me. Could be.
Yeah.
But yeah, it can happen to all of us.
100%. Yeah, absolutely. And that's what this is. It can happen to anyone, and it probably will. You know, we will have some moments in our lives where we will struggle, and that's everybody. That's not just the odd few. You know,
no, but you get stronger. Yeah.
Oh, definitely. And it's how we react and how we bounce back or come back from.
Yeah, but also how you're supported at home and at work.
Yeah,
that's also very important. But I really fear now for the children. Yeah, this is really
it's a hard time for them. It is a hard time.
So
well, we'll keep talking about all of these things and the kids and
we definitely will.
Everything else. We're never going to stop talking about this conversation as long as there's a conversation to be had. So Odete, I just want to say a huge thank you. Thank you so much for joining me this evening. It is an evening recording. I couldn't even tell you what time it is. It's getting
late. Is it? About 8:30. So
it's nothing
for me.
Yeah, it's nothing. It's nothing for me. I'll be around till tomorrow.
I know.
But thank you so much. I really appreciate it. It's been lovely to see you. I just want to send you all the very best for everything for the future, for everything you're doing as well. And please do, you know, stay safe and look after yourself and enjoy the garden and the dogs and the family.
I will.
And work will happen.
Yeah, of course. Yeah, we need it all.
No
Thank
worries.
you for having me, Matt, and good luck for the rest of the interviews.
Thank you.
I'll be thinking of you, so
thank you. Yeah.
You manage.
All right. Take care. Lovely to see you.
Yeah, likewise.
Bye-bye.